chapter, I've got the task of being trying to keep us on time, but also keeping the spirit of dialogue open. So I want to set some ground rules. There are no stupid questions, and especially for our panelists, there are no ideas that are too bold. I want to take you on a little bit of an exercise and a journey. The bios of our panelists are in your program, so I'm not going to read through them, but I do want to emphasize a couple of key points as I introduce each of them. But our ground rules for today, for all of us, including myself and the panelists, is that no ideas are too crazy, radical, because this is about innovation. And that 2, we have to suspend our judgment. I think that's a lot of what we try to do by coming to a beautiful place like Aspen, Colorado, is getting out of our silos. So we tend to talk to each other and what is familiar to us, but I'm going to ask for all of us, including myself, to suspend our reality a bit and suspend our judgment, and that's it, and we'll have a good time. So we're going to try to keep there is also a PowerPoint-free zone that we have that we're running, so we're going to keep it to lively, interactive discussion, and to that end, I've got mics, but we'll just see how time allows us, and people can shout out some comments or questions, and I'll try to do my best to moderate. So starting from your left is Dr. Anjali Jain. She's a senior researcher and managing consultant at the Lewin Group, but perhaps more importantly, she's a pediatrician, a mother of 2, and has spent kind of her life dedicated to this intersection of being a caregiver as a mother, as well as a caregiver as a pediatrician, as well as someone who has to think about the system of healthcare. Next to her is Dr. Joe Hutter, who is a practicing physician, a radiologist, and a fellow in the Institute for Healthcare Delivery Research at Intermountain Healthcare. For those of you who are not familiar with Intermountain Healthcare, located in Utah, it's considered one of the most premier healthcare organizations that does exactly what we're gathered here to talk about, innovation. So if you are not familiar with it, you should be, because it has been cutting edge. However, when I say that, I have an asterisk next to that, because cutting edge in healthcare is not necessarily cutting edge in the world, and so we have a lot of work to do. And then last but not least, Brent Parton, who co-founded SHOUTAmerica, and it's an organization, and I've known Brent for a couple of years now. He really has he looks young, but he's starting, I can tell Brent's been in DC long enough that it's starting to show. He's getting some age. He'll be in my good company not too long from now. And he's been spending his life trying to understand how to bring the youth voice to not just healthcare, but a lot of the social issues in which we often find ourselves saying, do the youth care about these issues? Yes, they do. And people like Brent are trying to lead them. So with that, I wanted to start off by being, I'm not John, I cannot play the piano. I am musically challenged and only can use my iPod, but wanted to just start with something for our panelists, rapid fire as we can be. What is the one thing each of you would do, no limits, no concerns, no judgment, no constraints of any practical nature, that would radically change the healthcare system? So I just in fairness, I asked them this question a couple of days ago, so they had some time to think about it, probably when they were stuck in the Denver airport or trying to survive the puddle jumper that brought us here. But starting with Anjali, give us your one thing that you could do that would radically change the healthcare system as we know it.
And can you hear me? Okay. Right. Well, thank you for having me here today. And this is the first time I've been to anything related directly to the spa industry. But I do think that we're in the same business. We're trying to help people be healthier and lead more meaningful and productive and high quality and longer lives. I've been sort of struck as a pediatrician and a mother. I think about kids a lot, and I was a child myself, as we all were, but I try to take that perspective. And one thing that I think that I haven't heard here is really any mention about children. We are operating in an adult world. We're fixing adult problems, but if you think about it, a lot of the good habits and the bad habits that we all have and that we all fight to change really began during our childhood. So if I were to do one thing, it would be to really refocus the center of the discourse and the discussion and the perspective to thinking about what that child sees and what children see currently in our world that might be able to prevent some of the problems we're dealing with now. For instance, if we think about the child as consumer, and I have to say I've always resisted that. I think children should not be seen as consumers. They're not consumers. They should not be exposed directly to marketing and so forth. But the fact is they are. They are a lot. They see a lot of ads. They see a lot of modeling behavior. They see and hear and touch all kinds of things that, you know, if we really thought about it, they shouldn't. For instance, children as young as 2 years old recognize a lot of brands and the associations of them. They know the golden arches above everything. The most widely recognized public figure for a toddler is Ronald McDonald, second only to Santa Claus. So if we think about the world from their eyes, I feel like a lot of the other problems would solve themselves and adults could take care of themselves. So what I would try to do is really change the perspective that we operate in and think about how do we create the lives for children that they're going to want to then be able to continue throughout their lives for lifelong health, and then would then carry on for their families in turn.
Great. Okay, Joe.
It's an honor to be here with you. Two healthcare worlds are emerging. There is the world of care coordination organizations, ACOs, or accountability care organizations, the medical homes, health homes, community health teams. You all are aligned with that world. Then there is the old world dominated by fee-for-service. The problem is there's only about 25 to 30 pioneer ACOs or accountability care organizations, which Kavita actually helps design, but there are over 5,000 hospitals out there. So how do you reach the rest of them? How do you reach the other 98%? That's one of the key questions we have to deal with in the delivery system reform part of this. How do you take ideas that emerge in those new models of care and transplant them and diffuse them across the nation? For that is how we are going to improve quality for the majority of Americans in this country. That is how we are going to render Medicare and Medicaid solvent in our generation. And some say that is actually the challenge of our generation. It's the biggest threat that we face in the United States and for some time to come. So the Innovation Center, which I'm sure many of you have heard of, it's in the CMS, Center for Medicaid and Medicare Services in Government, often called the crown jewel of the healthcare law. That actually doesn't do this job. What's needed is a translation or an innovation diffusion center. Fortunately, such a center exists. They just don't know it yet. It's actually called, it's another government office, it's called the Coverage and Analysis Group. The legislation authorizing them to do this type of transformational change has already existed for the last 50 years. It's in the original Medicare law. So what is that language? It's called reasonable and necessary. What we do, what we pay for as a nation in terms of services, treatments, and devices, and treatments, as you know, should be more aligned to prevention and some of the things that reduce stress, and other things which is the space in which you world. So what determines reimbursement basically is what is deemed reasonable and necessary. Well, there was a time when the doctor, as a standalone expert, the Marcus Welby, would determine this based on their experience. Today, multidisciplinary teams working with evidence-based peer-reviewed literature develop protocol, and that's how it's determined. So you've got this dichotomy where the practice of medicine has evolved, but the way we pay for medicine has not. And I'll give you a quick, actually, I could give you a very quick example of
Very quick.
When we order a CT of the chest to rule out pulmonary embolism, a doctor is going to write CP, chest pain, or SOB, shortness of breath. That's good enough for payers, public or private. It's not actually what we do. At Mayo, at Geisinger, at Intermountain, where I do, we have these rather long evidence-based protocols. They're not handed down by government or insurance companies. We develop them bottom-up, multidisciplinary teams based on evidence where it exists, and that's what we use. And what the solution then is very simple, is we need to catch up in the payment side with how we actually are practicing medicine in the forefront. And so the way to solve that diffusion problem is really that when such protocols emerge, when they are demonstrated to work, then we need to insist that that process for determining, in the words of Institute of Medicine, the right care for the right patient at the right time be used by everyone and not just a handful of locations who are striving to become even more excellent. Will that improve quality of care globally? Yes, it will. Can it actually solve by itself the problem of Medicare and Medicaid insolvency, probably the greatest challenge of our generation in the US? Yes, it can.
All right, Brent.
My solution drifts a little bit outside of the healthcare realm, but there has been a lot of work done by the OECD as well as by Robert Putnam about the connection between the concept of what's called social capital and health. Social capital is more or less the ability of a community to kind of bridge its own differences, and at its core is the concept of trust. And a lot of this work has talked about, well, maybe we can forge trust on a more local level. Don't think about the US as having one healthcare crisis. It has 25,000 healthcare crises in each city, town, village, and so on. And if we can do that on a local level, maybe we can improve social capital and trust. My one thing that I come back to is the local approach is going to be necessary because that's how you affect social and economic determinants that people face. But on a national level, what is eroding trust in our institutions and our ability for our leaders to address our healthcare issues as well as a number of other issues? And it's campaign finance reform, in my opinion. I think that that's something that would restore trust. It would put trust in back of the fine experts that we have in Washington that deal with healthcare issues and know what the exact fixes are that we need to the problems. Mm-hmm. And it's something that people need to have the trust for them to do it. And I think getting a lot of the money out of politics, especially healthcare money that goes around, is going to go a long way to start that, rebuilding that trust in the country, enhancing the social capital, and eventually enhancing our health outcomes.
You're here. All right. So you're getting a little bit of a flavor. We're just getting revved up, and I'm going to ask our panelists to tell us a little bit about each of them represent kind of different perspectives. And as we worked on this kind of topic of reinventing healthcare out on the table, we wanted to try to understand how some of these various pieces fit together. So each of them are just going to do a couple of minutes on what they do and how they see wellness kind of fitting into what they do in terms of reinventing the healthcare system. I just want to tack on, so I'll take moderator's prerogative to tell you my idea, which is comes from Richard Feynman, who some of my friends know my husband is completely personally obsessed with, the physicist. And he once said that I cannot understand that which I did not build. And when you apply that to healthcare, it shows you why everything is so absolutely misperceived in our healthcare system. None of us really understand it. We all see it from one viewpoint, and even as a patient, we probably understand it the least. So my radical idea was, instead of the way we now pay doctors and health systems and insurance companies are used to leverage those payments, let's actually pay patients. And then we have to actually be forced to audition, so to speak, and try to show our worth to the patients in terms of what they need and where they need it, so that they're not forced to wear humiliating gowns in a sterile environment in a waiting room and wait for hours to receive lab results, which are based on their blood work. So my radical idea would be to take all that money, the trillions of dollars that we're using in healthcare, divide it across everybody that lives in this country. So I'm thinking about the US. You could apply this to other countries, regardless of immigration status, regardless of some of the other things that we tend to put artificial boundaries around as human beings, and let them decide. And then I can promise we'll have a culture of hospitality, wellness, and true service, and bring the best of medicine to that. So that's my radical idea. And there is no chance in hell that anyone will do it. But that's, again, the beauty of it. If we can think about what we want the utopia to be and work backwards, then maybe we'll make some small marginal change, but then have something big that leaps out from that. So take that home. So Anjali, on the topic of thinking about reinventing our healthcare system and what you do in that process, where does wellness fit in?
Well, I try to think about wellness throughout my work. I do a variety of things. I mostly have been working previously in the obesity research field, and very much among low-income families, especially, and looking at parenting. This line of work really got started because I was working with families in the south side of Chicago and really trying to get them to try to be careful about the food and activity level of their children. And I realized some of the barriers they were up against. And so I feel like my role as a physician and a researcher is to almost be a bit of a steward for the patient and the family and the sort of microcosm that they're living in, and and with a real central importance to what happens every day.
Would you agree that most doctors, though, do not know anything about or do not think about wellness? Is that fair or is that unfair?
Yes, I would say that's fair, but it's also that we weren't trained to think about wellness. And so it's only now really trickling in, and I mean that very literally. Only little bits and pieces of things like nutrition and wellness overall and prevention are becoming part of medical school training. And you used to hear a lot of these kinds of statements that I'm a doctor, I'm not a social worker. And that kind of attitude, I fix disease, rather than I really take care of the patient to live a healthier life. I think that is a change that's slow in coming, and our institutions of higher learning that are supposedly higher learning that are training young physicians are slow. So it's happening, but it's taking a long time, and probably a lot longer than it should.
All right, Joe, how do you think about wellness and this concept as we've spoken about it in your work?
So basically, what do I do every day, and how does it sort of overlap and touch your world? In a book called Cybernetics, the mathematician Norbert Wiener observed that some of the richest areas of innovation lie in the gaps between the structured disciplines. I live in that space, or at least I try to live in that space. I work at Intermountain Healthcare, and I work for Brent. One of the guys I work for, a mentor, Brent James, is the chief quality officer. This is 22 hospital healthcare system that has an institute basically devoted trying to do clinical innovation and transformation. And one thing that's interesting is the whole point of the QI process, with the quality improvement process, which was really started by W. Edwards James, the statistician. We didn't listen to in America, Japan did. And the point of this is to solve problems before they happen. So you keep pushing interventions upstream in the quality improvement process. That is the core of prevention. That is the space that you guys live in, and as well. And I mentioned that idea of trying to get ideas that are emerging in these sort of these new models of care and trying to diffuse them throughout the system. So what do I do on a day-to-day basis? I work in the quality improvement, but there may be an opportunity for me actually emerging to go into government to do exactly that task. And so a little bit early to announce that. I would still maintain my affiliation with Intermountain, but that's a possibility. So
All right,
that will
great.
be very exciting.
Brent?
So I guess it'll be easiest to just describe what we do a little bit, because wellness is definitely at the core of it. And what I mean by that is we were founded to really represent the interests of this 18 to 34 demographic in healthcare issues, which back in 2008-07, when we were first founded, it was really because this was thought to be the group that was disenfranchised by healthcare. They were the least uninsured group. They didn't care necessarily about accessing healthcare resources because, hey, I'm healthy. Now, we found that to be a problem unto itself. Obviously, you want to get everybody into the system to at least have a stake. The other main problem is that it was symptomatic of a wider problem in healthcare. And it was the fact that the types of services and the needs of this population weren't necessarily readily available, or they weren't really the core work of what the healthcare system does. In the sense you have an acute-based care system that tries to treat you once you're ill. And so a lot of what we do in terms of our advocacy might have been around insurance, especially during healthcare reform. Now it's a lot about making sure that preventative services and access is opened up to what this core constituency needs. And what this constituency needs is prevention and wellness in large part. Another piece of work that we've done just though is around the concept of health literacy 2.0. Health literacy is a concept that's been tossed around a little bit already this morning. we've tried to expand the scope of that a little bit, meaning that to navigate and be a participant in healthcare, it means a lot more than knowing where your doctor is and knowing what the directions are on the prescription label. It's about being able to sort of navigate this broader healthcare ecosystem out there. And I think that's a lot of the idea of what we're trying to move towards in terms of creating communities that are more conducive to health and making sure people are able to navigate choices in a way that produces better health outcomes. And a big piece of that is creating what we call health citizens, or people who are health literate at another level. The last thing, though, is just something I've picked up on just being here is that there's really a cultural underflow to sort of the concept of wellness and health, and it's been somewhat restricted to some groups, I think, and there's huge inequities in terms of who gets to participate in that. But we're working with a documentary that's coming out this October. It's called Escape Fire, and the idea is that this is a documentary, it's a cultural piece, and we want to make the healthcare delivery system something that's cultural as well. And I think that is going to give us an opportunity to weave together sort of this cultural wellness aspect with the problems we have in our delivery system, and maybe it can yield some solutions that are synergetic.
All right, great. So we have a couple of other things planned, but I wanted to see, there's such a large group here, if we had any questions, and I can repeat questions and do things like that. So if folks do have one, I want to keep hands up. I see one in the front here, and I've got a mic, if someone wouldn't mind. We could even use it potentially, or I can, since you're close enough, I could repeat it, and then I'll have our panelists close with something so that we can get a little questions in, although I don't think this works, which might make it. Go ahead and scream out your question, as I know you strike me as someone who's had to scream sometimes, probably to make sure that someone in your family is paying attention, like I do my family, so.
The spa world to the wellness world, and that involves, and I'm talking global, I know the US is very different, and the things that the problem that we're coming up against all the time is the resistance by the medical world to complementary medicine and alternative medicine, and obviously the cost of it to the consumer as well, and my personal passion is wellness and complementary health, and I wonder how we can expedite that process to integrate the two, because integrative medicine, as far as I think everybody in this room is concerned, is the way forward, but we're all meeting barriers and blocks, and this is in every country. I work in 55 countries, so it's not unique.
So I have some answers to that, but I'll defer to some of the panelists.
I'll say a word about that. I think that medicine was very patronizing in its roots. And so I think the idea of patients being...
Especially Western medicine, though,
well, Western
in particular.
medicine in
right,
particular,
right.
Of patients
Say the Indian women. Right.
having the premier voice in decisions about what they're looking for is starting to become accepted in a very traditional field. So I do think that one way to expedite attention to alternative and complementary medicine is using research and showing that this is what patients want, this is what works for them, this is what is the way forward with data, with results, with opinions of qualitative research around what patients are really looking for. Everyone is asking the question in healthcare today, what do patients want? There's the Patient-Centered Outcomes Research Institute, but very few people are yet reaching out to the patients to ask them. So you guys could be the first to try to make that happen.
Let me just say that globally speaking, I mean, do not diminish the power of the medical industry to fight back against these things. However, if you've looked, I think Susie and Peter even put out a study around this. I know McKinsey has put out reports. Over the last 3 years, out-of-pocket spending in healthcare on kind of traditional out-of-pocket spending has decreased. However, out-of-pocket spending in what we would call kind of alternative and complementary medicine has increased, and we've seen those trends worldwide. However, the medical franchise, and when I say franchise, physicians primarily, because we still hold the ability to as long as we hold the pen or the enter button for therapeutics, we still hold a lot of power. So not only is the research important, but I think there's a real case to be made around the return on investment in integrative medicine, and places that do it well. I trained at UCLA, where we had an East-West Institute that brought that into disease and chronic disease management. They were able to show reduced hospital stays, reduced ER utilization. They were able to tie it to very hard financial metrics that even the most conservative of medical staff and chief financial officers could not argue with. So the challenge therein is then how do we assure, there's also a discrepancy, I think, in the perception of your training. And I don't mean yours, but I mean in this wellness movement. So there has to be a clear set of standards for the workers in the field, and I know that's something your profession is dealing with. When you all come together and think about what those criteria and standards are, this is very similar to the discussion that took place in the early 20th century for the medical doctors. And they used to have no restrictions. And so I think you're seeing a lot of interesting parallels. And my prediction is that the pegging this to some of the financial metrics as well as patient outcomes through some of this rigorous measurement, which you're already doing in certain areas, will yield to success. Joe, did you want to add to that?
Yes, in Kavita's world, where people are voting with their feet, I think they would want to have a product that includes your wellness concept.
Right.
As part of a more general thing.
Right.
And I think in that future, as you move from spa to wellness, you're not going to have so much, you're not selling a checklist of services where different type of massages are 70% of that. You're going to be selling an active philosophy of how to live. And that combines exercise, nutrition, meditation, stress relief, which can include hot stone massages, if you ask my wife, and myself, medicine and science. And so I would say, go form those alliances where people are at the leading edge, whether UCLA or we have colleagues who do value-based insurance design, an economist at MIT and a group of doctors at University of Michigan. And the concept there is we're going to pay for prevention. We're going to incentivize you to change your lifestyles, whether it's staying compliant or adherent is the better word to medications, to losing weight, that type of thing. And what you want to do is align with those type of people, and so that when they're in a program that says, okay, here's the program, and here's your coach or whatever who's going to help you, guide you through this and guide a group of you through this, instead of just focusing on their hemoglobin A1C for diabetes or their systolic and diastolic blood pressure for hypertension, they're also going to include a package of these other things, and that's where you play. And you'll be part of the incentivization for living better lifestyles, because I tell you, that's probably the thing of the future that's going to make the biggest change.
There's still huge resistance, though, from the medical profession. We're all doing that. Mm-hmm. We're doing what you're saying.
Yeah. I would try to co-opt a few of the doctors that might quietly agree with you as well.
And I think that there is, I will say, as a medical profession, that it's a very large, obviously, I mentioned why it's so difficult. You know that firsthand. However, again, financial metrics, there is no question in my mind that what will overcome, I mean, we're seeing doctors being pushed into the corner for engagement with community health workers that have minimal training. However, they do have standards and accreditation and certificates that are issued to them, because we know that community health workers can do far more than I can do in 7 minutes in a white coat. So I will say that I've seen just in the last 5 years a trend in which, and this scares doctors, it scares my friends, because it worries them that they will be out of business. One thing that you can do is to reassure them, and we all try to do this, they will not be out of business, so to speak. They will just have to think about health and wellness in a different way. And I do believe that it's this generation that's going to have this done. This isn't several generations away. And I believe it because people are making financial decisions in the US. And then I'll mention India, Brazil, and China, in which I had worked, some work with their countries that we do as part of Brookings, especially in India. India, China, and Brazil have all had increasing rates of obesity, as well as an aging gap in which they've got a much older generation of people that don't have caregivers or don't have infrastructure for caregiving. And now, interestingly enough, in other countries, they're trying to ask the US how they dealt with these issues, and we said we didn't. And look what has happened to us. So I think getting in front in other countries of the challenges by saying, here are some solutions to what we think are, going back to Philippe's talk this morning, a geopolitical crisis of a healthcare nature, are a huge way for your industry to be put in a position where you're not just being forced to be reactive to what the medical industry is saying, but you're just saying, here's what we know, and here's actually how we're dealing with some things in the global economy that are not being dealt with. And that's, I mean, just certainly, at least I can tell you that the firsthand experience in other countries is that they're starting to struggle with what I'd say are Western diseases, because we've exported it, as they talked about this morning. There's some other, Mike is live. Go ahead.
Great panel, thank you. I had to address a couple more social determinants of poor health, which are increasing social isolation, loneliness, and depression as well. I mean, we all look at diabetes and obesity, but as a medical anthropologist, I look at the larger social, cultural milieu, and I wonder what you can see within healthcare and partnerships with spas to maybe address social isolation and loneliness as true risk factors now for all-cause mortality.
Brent?
There's one example I can speak to, and the U.S. military has transformed American healthcare before. It happened after World War II. This was mentioned earlier today. And if you want to talk about an area where there's a concentration of a lot of these issues you're talking about, where they're trying to figure out how the VA or how the military can start to deliver care to meet the new issue in their core in terms of what people are facing when they get out of combat, and a lot of these are mental issues. I know that they've put together an integrative health task force with the military, the head of the health corps.
Yeah.
I know that is a strong example of them sort of looking outside the box, and I think even just speaking or looking at how that model was replicated is something that would be a good step forward.
One of the things I wanted to say is just I feel like a lot of these problems really track together. And one of the reasons I got very interested in obesity is it's because it's about all of life. It's what you eat, it's what you do, it's how much you sleep, all of those things. I think the failure of sort of traditional medical medications, surgeries, procedures to solve the obesity problem has actually caused a lot of movement towards the community level and the community role in dealing with some of these issues. And so the CDC, for instance, is funding, most of their efforts are in schools and in communities, including churches and so forth. So I think that solving one problem often helps the others, and I can see that wellness initiatives and the spa industry would have a role in all of that, actually.
So I'll say something about spas and loneliness. So I think that loneliness is a social determinant that we don't acknowledge. And I think that our next speaker is from Google. In this ironic age where we should be the most connected in our society, we've actually been seeing an emerging trend now where we are more isolated than ever because of that. Now, I'm not arguing with the connectedness, it's just the implications of that are serious. And we know in healthcare that there have been some studies that show this link between isolation and this concept of loneliness. Spas are the only place I have been to in which there's this kind of immediate cultural acceptance once you come in the doors. And I don't know if it's because you all realize that you share a mutual emotion and that brought you there, or it's a shared set of experienced backgrounds because you were willing to go and make the appointment and be a part of it. And those of you who've been to, I've been to the Korean spas in Koreatown, and I thought, these women are just ready to get naked in front of each other and they have no concern or cause to pause. How do we reproduce that? How do we reproduce the confidence and the community that comes together? So I think that in your spas, and as well as in your hotels and in your lines of business, you've somehow identified something that's a community, yet I don't think you've successfully leveraged that to deal with, as you merge from, in your words, spa to wellness, how do you successfully leverage that into the wellness space? And I think what I would perceive as the lack of acknowledgement in the traditional medical model is a huge opportunity in what I think you all have been doing as day-to-day business, but you've never, and I don't know if that means you market yourselves as a community in which you can be a part of something and it's trusted, and it's all those things that I think of when I go to a spa, but it's more than that. And that might be where you're stretching as an industry, I think, a little bit. Any other questions? Because I wanted, we're going to try to stay on time, so I'm at about a 4 to 5 minute mark. Any other comments or questions from the audience? Oh, there's right back there, and that'll be the last one, and then I'll have a wrap up, and we'll be somewhat on time, so it'll be good.
I just want to reiterate what you said about the often solutions compound to fix a lot of problems, and one of the areas of obesity is about food systems, and it links with what we heard today at lunchtime about energy and carbon footprint. And one of the radical changes I'm seeing and working with is the urban agriculture movement, and getting community gardens, organic gardens in schools and kindergartens. And you find that when people get involved in their own food production, it's the best thing you can do for food security for the population, but also it creates social capital, because you get people from different generations and different cultures all working together. It's the best thing for food nutrition, because you're eating seasonal, local, organic, whole foods. And it also helps with vitamin D and exercise, and you're getting out and connecting with nature. And there are many levels. So that's one thing that also brings the spa experience, on one of the previous speakers said, to bring the spa experience to children and to the public. Mm-hmm. And I think Deborah Seike, 72 years ago, created her spa experience, which was about eating organic food and going out into the garden and connecting with nature. And I think that's something that this industry could help foster and promote, is that connection with nature, food production, organic food production, and building social capital around that. And I think that whole urban agriculture movement, green roofs, building social capital through local resilient 25,000 systems you're talking about that each have their own problems. Well, then communities come together around child rearing and food production, and they have the touch of that spa experience in that. So I think that's a potential way forward.
It's a great challenge to put forward. Any comments?
It's that's a really interesting idea. A lot of ideas have come out, and I think that's the first time I've heard that today. And when you think about it, you're tapping into the Muhammad Yunus leveraging social capital idea, this bottom up, and then that produces your 25,000 microsystems which emerge, and the whole is greater than the parts. I think it's a great idea.
And even the little bit of discussion earlier today about cities and walkable cities where you actually see each other, get to know each other, trust each other, feel less lonely, come together around food and activity in a way that's very, very natural to the way, at least our bodies were designed to live, and our hearts and minds as well. So I do see a lot of those sort of oasis kind of sprouting up, and I think it is part of a larger movement, and it will get better. But it takes, the social forces to change, as well as the grassroots, and it all will sort of reach a critical mass, I hope, sometime soon.
And then there could be an organic restaurant or a cafe that buys its food from that place, and that's part of the whole marketing strategy.
Part of the economic mobility of it. All right, so rapid fire. I'm going to ask them to do this in 30 seconds or less for each of them. I'll start with Brent. We have leaders from around the world here. We've talked about some of the challenges. There's a little bit of we always tend to concentrate in the US, but please try to think global about this. But kind of building on this concept of innovation, how would you encourage them to think about being innovative in this space of transition as well, from spa to wellness and health and wellness?
I think that we have these things called education institutions. Whoa, in the concept of education, I told them I moved around a lot. You want to go from being sort of enclaves of innovation to what I would call beachheads of innovation, where it means you're staking a claim, you're able to scale out and move. So how can you do that? How can you leverage the education institutions we have to do that? One, I think that just what has been said already, just in the last comment, or what was said this morning, about how do you bring more aspects of sort of the spa experience earlier on in life, in smaller doses, whether it's helping work on a garden or something like that, is something that would be powerful to start to get people used to this being something that's valuable and it's something they want to continue to experience over the course of their lives. The second point, though, would speak to almost thinking about your workforce and the type of people you want to lead your industry going forward. And I've seen you look at an issue, a global issue like unemployment, youth unemployment was mentioned over lunch. If you could create those standards and competencies for all these different occupations, I've worked in workforce development policy with the World Bank. They say that there's a bias against vocational and technical education because everybody thinks you're going to be a plumber. No, it doesn't have to be that way. There's a lot of other soft skills, and there's other industries out there that use people that are able to bring certain skills to the table, and if you could certify them and give them certain competencies, and investing in that workforce and bringing them up to the level to be really the human capital of innovation, I think is something that you could really look to do.
Great. Joe?
I think the best advice I could give is just the one that we discussed already, where you're not selling a checklist of services, you're really selling a philosophy of how to live, and it's multidisciplinary and involves medicine and science and stress relief, which is sort of your core, I think, and then co-opting the physicians as you can. And on that point on stress, I think you're on the right track in dealing with that, and the rest of us have to catch up. I think stress is one of the most underrated mental and physical diseases. It impacts all other diseases, perhaps even more than obesity. The thing is, we can measure obesity. It's harder to measure stress, so we haven't discovered it. You already have. But at some point when we do discover it, if it's 5 years or 10 years from now, who knows, when we do, we'll find it's a continent, not an island.
Yeah.
And you've purchased land on that continent.
Yep, that's true. Anjali?
This came up at lunch a little bit, where I was talking about the role of the family and how I think, at least in I could be wrong, but in my conception of how spas work, it's usually an individual, a woman or a man who's going and getting their spa treatment in this little bubble, which is often like a cocoon and very comforting, and then they go back to their regular life. And I wonder if there's a way that there could be a little bit more that they carry out of their spa treatment that might influence the rest of their life, both to be a role model for their family and their children, but also to really carry the lifestyle forward that can then transform their communities and the sphere of influence that they have, so that more of a ripple effect. And I wonder if you can conceive of wellness and spas on that community kind of level.
And then I'll put a plug in for something I've spent a lot of time doing work in mental health, and we've got 1 in 8 Americans that have depression, 1 in 100 that have schizophrenia and other serious mental illnesses. However, we know that some of the best therapies are around what we call cognitive behavioral therapy. A challenge to the spa and wellness movement would be how to identify the best principles of what works in those therapies and apply it. You have regular consumers of care who are also affected by these disorders, who also need to find a place and a space in which there can be thoughtful, evidence-driven, however humane-centered treatments that they can somehow have as part of their entire wellness package, as Joe talked about. So anyhow, that's another bold idea, hopefully not too bold. So join me in thanking our panel, and we'll try to